Hello, my name is David Roy. Today I'll do a short video presentation on my capstone paper. The topic of my capstone paper is narrative review on influence of motivational interviewing on reduction of substance abuse. These are the track competencies which explore a public health problem in terms of magnitude, person, place, and time. Identify the cause of the social and behavioral factors that affect the health of individual and population. Identify the basic theories, concepts, and models from a range of social behavior disciplines that are used in public health research and practice. Utilization of evidence-based medicine concept in the development of evaluation of social and behavioral science interventions, and specify multiple targets and level of interventions for social and behavioral science programs. Motivational interview is a counseling method that helps people to resolve ambivalent feelings and insecurities to find internal motivation to change their behavior. Some of the epidemiological data is that 85.6% of the people ages from 12 and older reports drinking. Prevalence of alcohol use is 15 million or 5.3% in age 12 and older in the United States. Nearly 182 million people use marijuana for non-medical purposes worldwide. U.S. population reported using marijuana use increased from 4.1% to 9.5% since 2013, and out of that, nearly 12 to 13% of which are used among young adolescents. ORS are the elements of motivational interviewing. It is a practice that builds upon collaborative relationship with the patients with basic communication style during counseling sessions known as by the acronym ORAS. These are as follows: open questions that encourage further elaboration and consideration, affirmation that fosters positive feelings in consultation, reflections that indicated that clinicians has understood, and summaries that reflects life-changing directions. Some of the open-ended questions are, what are some of the concerns about your drinking, smoking, and drug use? Tell me more about how you feel making a change in your life. How would you do things differently once you have made this change? What would be the best thing about making this change? What might happen if you don't make this change today? And what are some steps that you would take to make this change from today? Usual care are the basic care that are given to any patients who are in control group. Control group are usually compared against the experimental group. Participants are usually given medical literature, brochures, reference for educational purpose and addiction help. Some relaxation techniques such as music, exercise, and yoga can also help. Design and method. Steps that are taken to conduct the review is identification of research questions, conducting online database search using keyword to obtain relevant search, selection of the articles, summarizing, finding the articles, and analyzing results. For my narrative review, I used St. George's database from the Founders Library website, and since there I clicked on EBSCOhost, which gave me a wide range of database. Some of the inclusion criteria are that are included in my narrative reviews are academic literature dating from 2010 to 2020, papers which cite motivational interviewing as the main intervention of study, population involving addiction, research that has interventions to study population on reduction of alcohol, marijuana, or both, research on population with age group of 12 to 24, so mainly adolescent and young adults, and geographic locations are also uh, taken consideration only in the location of USA and Canada and Europe. Exclusion criteria are the papers that cite research outside of North America and USA, papers that were published and translated to language other than English, and demographic outside of our target population. Chat and chain talk are the two of the main commonly used motivational interviewing in papers that we reviewed. Most common Chat is the most common form of motivational interviewing, which is the one-on-one interviewing with the therapist. It uses four elements in ORAS that engages, focuses, evokes, and plans with the participants. Change talk is the second most common form of motivational interviewing that participates and engages in conversation in groups and therapists, which reinforces motivation to change. So, from my research, about 4,200 articles which cites motivational interview as an intervention resulted, which are also the research in USA. 14 of these select articles use motivational interview to reduce alcohol, marijuana, and drug use. Two papers conduct research on dependency in elderly and during pregnancy. 12 articles that I selected focused on alcohol and marijuana use among teenagers and young adults. All research articles, including the ones that are excluded from the conclusion, excluded are came to the same conclusion that motivational interview is an effective tool in reduction of alcohol, marijuana, and other substances, as well as having short and long-term benefit. Um, in my analysis session, I have uh, assembled all the researchers that concluded the hypothesis of my uh, narrative review. The research conducted by Elizabeth et al. 2018 in primary care settings in Los Angeles have found that adolescents who received motivational interviewing reported both self and peer uh, reduction of both self and peer use of alcohol and marijuana use at the age of 3, 6, and 12-month follow-up. There was also a reduction of negative consequences associated with this substance use. In Bernstein et al. 2012, a study conducted by Bernstein, Herring, and Dorfman in pediatric population of age 14 to 18 shows that BMI during an emergency visit and a 10-day telephone follow-up in conjunction increases attempts to quit alcohol and marijuana use. Authors in Stein et al. Uh, intended to study the efficacy of BMI over 3 months on population of adolescents who are previously incarcerated. This study suggests that the adolescents who have reviewed BMI treatment over 3 months compared to a control group had lower rates of alcohol and marijuana use at the end of 3-month follow-up. Devon et al. 2011 paper reports 20% reduction of binge drinking among groups which received motivational interviewing as a treatment compared to the control group. This paper reports that on a weekly basis, reduction of alcohol use corresponds to about 1.5 drinks per individual. Some of the long-term benefits of my review in my review came up as a benefit for motivational interviewing. In addition to short-term, there are also some long-term benefits. In Tucker et al. 2014, a randomized controlled study that attempts to evaluate motivational interviewing to reduce alcohol use as well as sexual risk behavior among homeless young adults concluded that motivational interviewing is an effective risk reduction intervention that helps young adults to make positive changes by decreasing substance use and consistent condom use. Increasing the days of abstinence in both Romanovich and D'Amico et al. In 2018 and 2013 respectively research conducted with a similar conclusion that BMI is an effective method in increasing the number of days participants are abstinent from alcohol and marijuana use. Study also indicates that participants who received motivational interviewing are likely to be more open-minded to receive future addiction treatment. Reduction in adverse psychosocial outcome. Palmer et al. In 2014 investigates into factors that are associated with adverse psychosocial outcomes. The study reveals that Alcohol and marijuana are commonly reported to compromise personal relationship with family, friends, teachers, and significant others. Change stock is a form of BMI that uses as an intervention in the paper, which after the study suggests that it is an effective intervention which can be used to reduce alcohol to reduce the adverse psychosocial outcomes later in life. Some of the limitations in this study are the measures of outcome that were different across the articles. Virtually all articles reported the reduction of substance use. Outcomes that were subjective Outcomes were subjective because they're pretty much self-reported by the participants. The idea of generalization is vague, and the length of the studies may not be long enough because the studies that we looked at ranges from 3 months to 2.5 years. In conclusion, the literature that were explored during this review indicates consistently that BMI is an effective strategy employed by therapists to reduce alcohol, marijuana, and substance use. In addition, BMI also have long-term effect in reducing sexual behavior, increasing the days of abstinence, and reduction in adverse psychosocial outcome. These are the table that summarizes all the articles that I reviewed, and here are my references. Thank you.